Good afternoon. We want to say thank you for joining us today. And today we are having courageous conversations. We're doing a mini series. This is Women's History Month. We're highlighting women. We're talking about the great accomplishments that they have done. And today we are being joined by Dr. Judy Brangman. And we are excited to have this very, very important as well as informative and exciting conversation today. Hello, Dr. Judy. How are you?
Good afternoon, Pastor Arthur. Thank you so much for having me on the show.
Yes. So we thank you for joining us today. Online, you are known as the plant-based doctor. And so I am so excited. I'm interested in knowing more about that. And so getting to know a little bit about you, just exposing our audience as well as our church to you today. Again, we want to say welcome to you for all who have joined us today for our courageous conversation. Would you do us a favor? Would you like as well as share this stream? Would you like as well as share this stream? And just let us know where you're joining from. And if you might have a question that we might filter or could answer at some point, you can drop that in the chat today. But again, like I said, we're so excited to have you, Dr. Judy, and be a part of this awesome and great conversation. So, would you just mind telling us a little bit about yourself, who you are, where you come from, and what you do?
Sure. So I am originally from Bermuda,
Mm-hmm.
and I completed my undergraduate degree at Andrews in clinical laboratory science. And at that time, had not planned to do medical school, so I sort of had a non-traditional route to
Mm-hmm.
medicine. I did an undergraduate degree in clinical laboratory science, worked for a few years in a hospital and laboratory doing that, and felt that I was led, spirit led, I felt, to pursue medicine. So I ended up doing a postbaccalaureate program at Wake Forest and matriculated there for medical school. So I graduated from medical school in 2010, completed my internal medicine residency at East Carolina,
Mm-hmm.
Vidant University, Vidant Hospital in Greenville, North Carolina. And since then, I've been working as a hospitalist, which means patients in the hospital setting. I've also worked in primary care as well. So that's what I do, kind of like my day job. But my real passion and what I feel called to do is to teach people how to eat healthier so that they can prevent chronic diseases, so that they can live healthier and essentially live their best life. Because we're all here for a purpose. I believe that strongly. And the more you are in health, the better you will be able to think clearly and do whatever it is that God has called you to do on this earth. So, in my job as an internal medicine doctor, I see a lot of sickness and people in and out of the hospital and whatnot. So, I try and prevent people from having to become chronically ill.
Oh man, wow! So that's interesting to know you came from another field, you felt the call, and now you are blazing a trail through medicine. I find it interesting that you talk about healthy eating. I know I've encountered doctors in the past who more or less say, I'm a medical doctor, so I'm into medicine. It seems like you're taking a different approach, and so I really want to explore that a little bit. So tell us the current. You said you're a hospitalist, so tell us kind of what that is, being a hospitalist. Um,
Yeah, so after medical school, you decide to do a residency. So you can do it in family medicine, pediatrics, internal medicine, surgery, emergency medicine. And residency can last from 3 years up to 5 years, and then you can do fellowship. So I'm general internal medicine. So I see adult patients with a variety of medical conditions. So anytime you come into the hospital, an adult comes into the hospital, they're seen by the ER. They do the initial workup, and then when it's deemed that they are needing more testing and more treatment, that they need to stay overnight, that's when they call us, the hospitalists, to take over the care of the patient once they get admitted to the floor.
Mm.
So
Okay.
back in the old days, doctors used to see their patients in clinic, and when the patients got sick, they would also see them in the hospital. But now internal medicine doctors either work only in clinic or only in the hospital, and I only work in the hospital right now.
Oh, okay. So you work in a hospital. Yeah, oh, that's awesome. So you get an interface with a lot of different kind of people. So that's cool. All right. So now I came across you online maybe like 2 years ago
Yeah, I think it was 2 years ago.
or
Mhm.
so, and you were doing this part of a vegan fest, and
Yes.
in North Carolina. At that time, I wasn't too far from I think it's Riley, and Riley doing one of
Yeah,
those
Raleigh
areas.
Durham.
Yeah, and so that was very fun to see all to go to that vegan fest and see all of the food. And you had
Yeah,
a
that was
huge,
awesome.
huge booth there. One of the first when you walked into this large assembly, and so and I saw that well, she promoting herself as a plant-based doctor. So can you explain a little bit more to us what it means to be a plant-based doctor, and how does that affect the way you practice medicine?
Sure. So plant-based nutrition is essentially eating foods that are not animal-based.
Hmm.
So vegetables, fruits, beans or legumes, nuts, um, different things like that. So not eating meat, dairy, eggs, and cheese. Now, different people differ in their definition of plant-based.
Hmm.
So the most strictest form of plant-based is probably either whole food plant-based, where they don't eat any processed foods. So things like oils they tend to eliminate or try not to eat, fried foods, packaged goods, even like Oreos, different things like that. And then you have veganism, where veganism is a little bit different. That's more of an ethical stance against
Hmm.
cruelty to animals. Um, so I don't use the term vegan. I use the term plant based to describe what I eat, and because some people that are plant based do eat eggs or fish like occasionally, but
Hmm.
majority of the people that define themselves as plant based would say that about 80 to 100% of the meals are plant based. So the term plant based gives you some flexibility, which I kind of like because some people do choose to eat fish sometimes, which is okay. There actually are health benefits to eating fish. Um,
Yes.
so I don't think that people have to be, fully vegan. That's definitely not what I advocate for. But the issue is that most people don't get enough fruits and vegetables. They recommend that you should have at least 5 to 6 servings a day. You
Hmm.
want to eat the rainbow is an easy way to remember it. So making sure that the plate has different colors of fruit and vegetables. So let's say you eat dinner, you have sweet potatoes, which is orange, have some corn that's yellow, and then have something that's green like broccoli or a salad. Or, when you do a salad, have different colors in it. So have green lettuce, red tomatoes, put some, you can put corn niblets in it or avocados, but eating like a variety of different color vegetables is going to be better for your overall health. It's going to increase your fiber, your antioxidants, your vitamins, and your minerals. So it's kind of like a different way of thinking about it. Traditionally, when we think about food, we think about the meat and we center our
Hmm.
meal around the meat.
Yeah.
But
Yeah.
when you recenter your plate around the vegetables, you're gonna get a healthier, a healthier plate profile, essentially, which is going to have so many health benefits from helping to lower your blood pressure, potentially lower your cholesterol, decrease your risk for type 2 diabetes, and can help with weight loss as well. So I kind of see myself as trying to just flip the script a little bit. So, like,
Hmm.
retrain people's minds around the way they think about food.
Hmm.
And also, sometimes in the Adventist community, we think of it in terms of vegan, vegetarian, and non-vegetarian, but
Hmm.
there are so many variants within those groups, and so I think of it as more as, instead of giving a label of vegetarianism, just look at the whole picture. So
Yeah.
processed foods is
Hmm.
important could be vegetarian and be unhealthy if you're eating a lot of fried foods and processed foods. And some people don't realize that.
Yes,
So,
yes.
looking at the label, just look at the quality of the food that you're eating, like
Mhm,
how
mhm.
processed is it, and how much of it is coming from an animal, whether it's milk, cheese, or a piece of meat.
Yes. Wow. So, so looking at the rainbow, and you're right, man. We do center. I grew up in Texas, so we center the meat first, and then everything else can come later. Or sometimes nothing else comes later. But
Right. Meat is like the main course, and then like the vegetables like a condiment, like a little.
yeah, if you can add on,
Yeah.
we call them the sides, like
Hmm.
the extra they put on your plate, right? So that is cool. So to know that we do that, put the vegetables first, then think about the meat. So that's a cool concept. Now, when it comes to plant based eating and women's health, I know you are expert in that area. So tell us how what are the benefits for women in particular when it comes to plant based eating? Since this is something that you're strongly advocating for, what are some of the benefits for women?
Yeah, certainly. So, plant-based nutrition lowers the risk for cardiovascular disease, which is same thing as heart disease, heart attacks, strokes, kind of all fall under that category, and that's the number one cause of death in the U.S. Men and women.
Wow.
Women present atypically. So instead of having the typical symptoms of chest pain, women may have like arm pain or pain like in their abdomen or just something that's very atypical. So sometimes women actually are um, misdiagnosed or diagnosed a little bit later just because they tend to present differently.
Mm,
And so it's really important for women's health to be put at a forefront as well so that we can make sure that we are staying healthy because oftentimes women are the caregivers for the families.
yes.
And
Yes.
so, one condition that tends to affect people of color is fibroids.
Mm,
So although there's no clear data to say that eating plant-based, cures fibroids or decreases your risk of it, there is some connection possibly between dairy consumption and fibroids. And
mm,
so that's being studied right now to
mm,
see if decreasing dairy consumption can decrease the risk of fibroids. But typically, if I have someone that's dealing with fibroids and has pain from it,
mhm,
definitely it's worthwhile to look into cutting out dairy, meaning milk, anything that comes from the cow. So cow's milk,
mhm,
cheese, ice cream, different things like that. And then there's also breast cancer,
mm.
which
That's
affects
good.
women as well.
Mhm.
Is one of the risks for breast cancer is diet.
Wow.
And so eating a more of a healthier plant focused kind of diet, not necessarily vegan or vegetarian, but a more plant focused diet can potentially decrease one's risk of developing breast cancer. And oftentimes people think that cancer is purely genetic, but with regards to breast cancer, only about 10% of it is genetic. A lot of it is lifestyle related.
Mm,
So, obesity is a risk factor for breast cancer. And obesity,
mm,
although there are genetic components to it, a large portion of it is lifestyle related. So, how sedentary you are, whether you're moving regularly,
mhm.
exercising, and what foods that you're eating is very important too. So, the main conditions that affect women uh, can be altered with diet, and that's the one thing that I really want to drive home to people because traditional medicine doesn't typically emphasize that. If
Mhm.
you go to a traditional doctor, they tend to want to give you a pill or
Yes.
say that you have to have this condition forever, or you're going to have this condition forever, and that's not necessarily true for a lot of conditions that people are dealing with. And let's be real, when you have a medical condition, it affects every part of your life. You're higher risk for depression and anxiety if you have
Mhm.
like a chronic disease like chronic
Mhm.
kidney disease, and then money, you got to spend money to buy medications, copays and different things like that. So it really all boils down to I think a lot of suffering could be alleviated if people knew that they do have some control over their health.
So wow. So just making those making better food choices impacts the health, along with some of the other things like exercise. So that's so critical because, like you said, we don't often hear that
Mhm.
this can change around. And that's interesting what you talked about the fibroids. I hadn't heard that. So knowing people who have battled with that, being able to give them that kind of information about cutting like dairy consumption can help when it comes to suffering. So that's critical. Um,
Yeah, I
so
had a I did a health summit last year, and one of the speakers was a plant-based OBGYN doctor. She specializes in treatment of fibroids, and she's testing that out now with some of her patients.
yeah. So this is probably something I didn't send to you as a question, but
Okay.
you know how they say, "Let food be thy medicine," right?
Yes,
That's the is that so nine?
be their medicine. It's I can't remember whose quote that is, but it's a very well-known quote, one of my favorite.
Oh yeah. Okay. So that's that whole play concept. So now I'm talking about plant-based eating, women's health. I'm a strong advocate for that. I think it could really do some great. So now you've also been dealing with this COVID-19, the pandemic, which has been something different and unique. I remember for our church, we did a presentation last year. But tell us a little bit about the COVID-19, and then what ways have COVID-19 affected women's health from what you've seen?
For sure. So I basically have been on the front line since COVID started. So definitely has been an interesting year for those of us in hospital medicine. Things are a lot better now. You know, we have testing, vaccines, and medication protocols. But in the beginning, it was definitely very scary because it was basically a new condition. Nobody knew how to treat it. So we were basically just kind of guessing, if it felt like. So there are a couple of concerns that have come up with regards to women's health and COVID. Number one has been increase in gender related violence for women that are in
Mm,
abusive relationships who have been
wow.
on lockdown
Mm,
and forced to be in their home for a
hmm.
period of time. So it's a concern about violence of women and abusive relationships. There's an article in Lancet last August. It's entitled "COVID-19 Has Devastating Effect on Women and Girls." And there's also another article that mentioned that 2 out of 3 caregivers in the US are women, and that women who are caregivers have higher risk for poor and mental health, including depression and anxiety. And the COVID-19 pandemic can add even more stressors to caregiving. So
Mm,
there's the domestic violence, the mental health aspect, and then also um, during lockdowns, there was a lack of access to services, so clinic closures, um,
mm,
in
mhm.
clinics that provide contraceptive care and sexual health services, you know, was considered non-essential.
Oh wow.
Um, so there was a study that looked at that and showed that there were a large increase in like unwanted pregnancies
It's,
in the early part of the pandemic
mhm.
because of that. So yeah, there were different challenges that women had faced as a result of the pandemic. I think the mental health and the emotional health probably is one of the biggest, and then lack of access to health in the beginning when clinics were closed and surgeries were postponed.
Postponed. Wow. So when you think about it, nuanced, you're like, wow, that it really does have a specific effect on women in those ways because they're carrying that load. Now, do you like do you talk to people about how to battle against like depression and things that sort of what tools that you might give them?
Well, I did a Facebook Live about it in the beginning part of the pandemic, and I did post an article to my website, theplantbasedmd.com, about managing anxiety and depression. Some of the ways were getting physical activity,
Mm-hmm.
seeing a therapist if you need to, not being ashamed to see a therapist. Um, Vitamin D, that's
Um,
super important for your immune health, but also for your um, mental health. Low vitamin D levels is associated with depression. So I recommend everyone to take a vitamin D, especially, right now, or at least get your levels checked. But most people probably are borderline low in vitamin D. And
Mhm.
so probably do need to take a supplement. B vitamins are also important for your mood as well. B12 and B complex is also important as well. So, mental health is something that's sometimes downplayed. We don't even think of it as part of health. We go to our doctor for a physical checkup.
Mhm.
We go to our OB-GYN for our pap smears. We got our mammograms, but we kind of like brush the mental health part, under the rug, or we don't like to talk about it. But
Mhm.
it's really important, and it affects everybody. And the shame that's surrounding it, I think, is a hindrance why some people don't really seek help for it.
Yep. Yeah.
I'm a huge advocate of seeking help for these things, whether it be a counselor, getting therapy. Yeah.
Yeah. Well, I'm a big advocate of that myself. I've gone to therapy and gone to counseling. I've gone to group counseling, and I found that it helped me tremendously to process things that I was going through, or even just trying to sort out. And even with the profession, the helping profession, so you got that issues of transparency and taking on people's issues. So it's good to be able to decompress. And so that is critical, mental health, because we really don't think about that. So that's critical, being because the brain is a muscle, so having that together really does matter, and especially for women. So let me. I'm kind of just asking you like kind of all over the place kind of questions.
That is
So,
good. Real.
so we started out with the plant based, and now with women's health. So let me just zoom in, right? Because I'm trying to just catch a broad audience of persons, right? So now, tell us your medical doctor. What are some challenges you see, some major medical challenges you see facing women today?
Women.
Just women in general. So I know we got the COVID, but what are some other things that you've seen that are on the spike, on the rise when it comes to women's health in general?
Oh yes, I was thinking women in general. Like I was thinking about gender inequality, um, but health related. I think I would say access to care. Minority communities. Um, we're seeing that being exacerbated with COVID, of having lack of access to care. And I
Mm-hmm.
think sometimes what I find, women, especially women who are parents, tend to do a really good job at taking care of everyone else, but sometimes maybe neglect their own care. So just kind of, putting it off going to the doctor, or putting
Mm-hmm.
off, getting that mammogram and saying, oh, I'll get it done later. I'll get it done later. But, you have to make your health a priority. Otherwise, you're not going to be around for your children. So I think that's one thing that women, what I notice, tend to struggle with internally is putting everyone and everyone else before themselves, but not realizing that by doing that, they're actually harming themselves and the other people because they're putting their health at risk. So if anyone's listening, you have not gotten your mammogram and you are due, or you have not gotten your colonoscopy, please call your primary care doctor and get that scheduled because it's better to get those things diagnosed earlier than later.
Okay. So going to the doctor is so critical. I
Yes,
want
I think every year, if you're 18 and above, you should be going to your doctor for a general physical and checkup. You can get your blood work checked, just like how you take your car in every 3 months to get oil change. You
mhm.
don't wait until the car breaks down to take it. You take it um, preemptively, basically. So it's kind of the same thing with our health. Sometimes I feel like we treat our cars better than we treat our health. We don't go to the doctor until we have symptoms like, oh, I don't
Mhm.
feel sick, I don't have chest pains, so I'm good. But what you don't know is that when things start out, it starts out small, and by the time you have a symptom, it's probably been going on for a little while.
A little while. Yeah. Wow. So absent prevention is better than a promised cure.
Yeah, exactly. It's so much easier to prevent um something than it is to like try and treat it and reverse it. Like diabetes, for example. Like I see patients that are newly diagnosed diabetic, and blood sugar is like 500 and up, they come in the
Wow.
hospital in DKA, diabetic ketoacidosis. That's like a serious condition you have to be hospitalized for. And diabetes doesn't develop overnight. It takes years
Mhm.
for, it to actually develop into full blown diabetes. First, you're like pre diabetic, and then you develop diabetes. So,
Wow. Wow. I know that's something that's they say plagues the black community.
mhm.
Maybe give us just a little insight on why that is. I know there are like food deserts or even food choices, a lot of processed foods. Why do you think that is?
Yeah, so the rates of diabetes is like 10% in the US population. It's a little bit higher in Hispanics and Blacks. I think it's like 11 or 12% higher.
Hmm.
But there are several reasons for that, as you mentioned about food deserts, but the lack of access to care. So, how far someone lives to a doctor's office. Some of these communities, they may not have transportation. They may have to travel far to get to the doctor's office. And then also, there's a lack of trust in the Black community around healthcare because of historically what has been done to people of color in this country. So we do not like going to the doctor. And only 5% of doctors are Black. That's
Wow.
ridiculous to me. Only 2% of doctors in the US are Black female. That is a extremely small percentage.
You said 2%?
2% are Black female in the US. That's crazy, isn't it?
Wow.
Yeah. So I think it's like if you want to find a Black doctor, it may be hard for you to find one, And so then you're like, you know what? Nah, I'm not gonna go. And so then by the time you go, you have no choice but to go because whatever symptom you've had is now full blown. So I
Hmm.
mean, I think a lot of times we're just diagnosed later with things. I've seen people that have been with um weak. I've even seen people with like weakness, like they really had a stroke, right? And they wait like a few weeks to come in, and by then it's like it's already done. Or people that have had like wounds on their feet, and
Mm.
like by the time they come in, it's so bad that they have to get an amputation. Um, so I
Wow.
think our hesitancy to seek medical care is a huge hindrance. And then, of course, there's also biases.
Yes.
When there's enough data on that to show that when a person of color um,
Hmm.
tends to seek care for pain, sometimes they're not really taken as seriously.
It's serious. Yes.
There was a situation, was it last year actually, a Black physician that had COVID. I don't know if you heard about that. She went to the doctor, to the hospital, and
Mm.
she was saying
Mhm.
that she had pain and was asking for a CT scan and other testing. And she was saying the doctor didn't believe her. They discharged her. She went to another hospital, and she basically did a video of herself on Facebook saying how she went to the doctor. They wouldn't listen to her. She was like, I'm a doctor, and they still didn't listen to me. They didn't treat my pain. And I don't know the whole course of her hospital stay, but unfortunately,
Mhm.
she passed. She died from COVID.
Wow.
So that led to a huge uproar in the health community because we were just
Hmm.
this should not have happened.
Wow. You know, think about the pandemic, right? So now with COVID, so you just pointed out, so racism. So there is racism in medicine, yeah, which makes us scared and not
Yeah,
want to go. And 2% of all doctors are black, of doctors are black women. That's it. That is incredible. So
yeah. So
I know they talk
I
about like,
get it.
yeah. So who do you trust? Who to understand? It's like what do women do when it comes to their health? Like they even take us serious. Wow.
Yeah,
What,
yeah.
what,
I think with possible try if you're more comfortable seeing uh, a doctor of color, try and find one. I sought one out, and I have a Black doctor. She's actually Caribbean too,
mhm.
so
Yeah,
that really helps.
that helps because you want to see if they understand the experience, know what we've been through, and can understand the plight. Um, wow. I kind of want to drill in on the racism piece because now I know this is not your area. And I didn't say this to you previously, but when it comes to like women in pregnancy. We saw like lot of high rate of death and things of that sort as a result of people dying. I think like Serena Williams had
Yeah.
a case, and some other famous persons. Have you seen that or
Yeah.
familiar with some stories related to it?
Yeah, I know the statistics. Maternal mortality is higher in the Black community. There was a that came to the forefront last year. There was a Black physician, actually. I think she was a OB/GYN doctor, and she died while she was pregnant. And I
Wow.
think it's kind of along the same lines of medical bias,
Mm-hmm.
medical racism, probably, not being taken seriously. I think, when you say you have a symptom, does the provider investigate it? So you really have to be your own best advocate and sometimes
Mm-hmm.
push for what you feel you need. Like if you feel like a provider's not taking you seriously,
Mm-hmm.
um, be a little bit persistent with it. And
Mm-hmm.
then if it's an outpatient setting where you have the option, maybe seek a different provider. But of course, in the hospital setting, you don't have that choice. But
Yeah.
in spite of this, um, the biases and the racism, I still don't want people to be so fearful that they don't seek care,
Mm-hmm.
because that is not going to lead to good results either, right? If you
Mm-hmm.
have chest pain and you don't go in, you have a heart attack at your house, that's not good either. So we have to kind of recognize that there is medical racism, medical biases, and whatnot, and put our faith in God and say, I'm going to the doctor today, Lord, say a prayer before you go if you need to. If
Yeah.
you need to like meditate for a little bit, read a scripture, so
Uh-huh.
that you are a little bit more confident and able to at least go.
Let's go. Wow. So now, I kind of this is so interesting. When it comes to the women's health and racism, so just pray and have faith. Whew, I just think about so many people who I know who have been affected and just wish they had stronger, like maybe even family advocates who, could just like say, hey, no, listen, they're in pain. And all that. I know COVID kind of made people worry. Only one person could come in the hospital, but
Yeah.
just maybe even having strong team of persons who can advocate for you, especially if
Mm.
you're down. What do you see that is the case as well?
Yeah, it's difficult not being able to have visitors in the hospital. So, yes, it's very helpful if you have another family member coming with you to your doctor's appointment. If
Mm-hmm.
you have a family member in the hospital, definitely make sure that there's somebody else that's calling and speaking to the nurse or the doctor. I think that's really important so that um, information is not lost, because it's a lot of information that is given to the patient from the physicians and the nursing staff, and sometimes it can be overwhelming. So taking a notebook and writing down notes, um, looking stuff up on the internet. I am not against looking things up on the internet, because then at least you will have a little bit more information. And don't be afraid to ask questions. That's one thing that I find differently sometimes about my minority patients compared to my Caucasian patients. The Caucasian patients seem more confident to ask questions. Like they're, I don't know why this is that case, but I find sometimes my minority patients tend to not ask questions and say yes, yes. So I don't know if it's that they don't feel comfortable asking questions of the physician. But with every patient, I try and like teach it in a way that they can understand and get them to say it back to me. So
Mm-hmm.
basically saying, don't be afraid to ask questions. There's no such thing as a dumb question.
Yeah. Wow. No doubt.
You had mentioned about maternal mortality. I also wanted to mention too about maternal mortality, neonatal complications, and COVID-19 positive
Mm-hmm.
pregnancy, because that's also been a kind of a concern too in the pandemic. If you get pregnant, there was a time when you could only have no visitors, when you're delivering. So what I found, this was in another article that said several papers have reported a high rate of maternal and neonatal complications in COVID-19 positive pregnant women. Um, According to a retrospective study of 46 pregnant women who were COVID positive, nearly 15% developed severe COVID, which occurred primarily in overweight women with other comorbidities.
Mm-hmm.
And COVID-19 was associated with a higher rate of miscarriage, preterm birth, preeclampsia, and C-section, and prenatal deaths for kind of unknown reasons. So COVID-19 came and just took the world by storm, and it's affects every organ system.
Mm. So for women, then, is there anything in particular? So because it's still around, and the vaccination is one. Is there anything else, especially pregnant women, can do to protect themselves during this time?
Yeah, for sure. Mask wearing is number one. That definitely has been shown to decrease the transmission because if you think about it, if you're breathing, you're sneezing, the particles are going to get trapped in the mask. And so
Mm.
there's less particles in the ear for someone else to then inhale those particles. So wearing a mask, the CDC has just said that people that are vaccinated that gather together can um, not wear masks if they're in a small room. I'm not sure how I feel about that just
Yeah,
yet per se. Um,
yeah.
but of course, wearing a mask, hand washing, and the messaging has been confusing. I think at the beginning they kind of went back and forth about whether masks work and different things like that. But definitely mask, hand washing. They're still recommending social distancing. Um, and it's been interesting. Usually in the winter we see flu season, and the hospital usually is busier with flu patients. But I have not seen one single flu case this year. And I'm speaking to all of my colleagues from different states around the country, and they haven't seen one flu case, which is so unusual. And so,
Mhm.
like, this must be the social distancing and the mask together um, is leading us not to see any flu, which is really interesting.
Wow. So that when you look back on the history and study this, you'll say, was it the mask? I would say yes.
Yeah.
That's
Yeah,
just my own assertion. I
I
think
think
it
we
worked.
probably used to wear masks for a while.
Yeah, so certain states like my home state of Texas, they just open wide. They just say, "Hey, we go." It doesn't matter. So people should still take control of their own health. That's what you're saying.
Yeah, I think so. I don't think that there's any um, reassuring evidence that we're out of the woods yet. The numbers of COVID are going down, but we have to remember it spiked in January from
Hmm.
the holiday season and travel. And so now it's coming down. If you look at the numbers in the US where it is now, it's kind of about the same that it was in May last year. And remember how panicked we were last May.
Hmm.
So we're still not out of the woods. We're still in the middle of this pandemic, and I think people are just kind of exhausted at this point.
Hmm.
But we have to still, maintain vigilance and practicing safety.
Practice and safety. Wow. So this is really good because a lot of people have been affected by it. It's like, is outside open yet? Like, when can we
Mhm.
do life? But I think just taking precaution and knowing that this is soon be over, soon be over. So now, since this is Women's History Month, I want to shift just a little bit and just talk to you on the STEM side of things, science, technology, engineering, math. Um, what do you? Why do you think it's important for women to be in STEM and in particular in medicine? You kind of highlighted a few of those things, but this kind of hone in a little bit. Why is it so important to have women and Black women? You said only 2% of all doctors are Black women, so that's incredible. Why is it important? And I think you highlighted some of that.
Yeah, so women add something unique to the sciences and to the practice of medicine. There was a study that surveyed patients, and they found that patients that had female physicians were more likely to feel that they felt empathy from their physician. They felt a greater connection to their physician and felt that they had better care from seeing a physician that was a female. So women add that intuition, you know, compassionate kind of feminine touch to
Mm,
the way that they practice, the way that we practice, and sometimes that can lead to better patient outcomes.
mm,
And so what I really love is how now, 50% of medical students are female. Most schools try to keep it around 50-50. But, 30, 50 years ago, it was predominantly men. I can't remember the year that the first woman was accepted into medical school. Um, but it was a big deal. At first, they did not let women into medical school. It
Oh,
just seems so bizarre now to think about it. Now, when 50% of
no.
medical students are women.
Whoa, so that what a revolution that is, and so hopefully we will see better healthcare in general. So also then the idea of representation matters. So how important do you think it is for other young women to see a woman doctor?
Yeah, definitely representation matters. Even not in medicine in general, but also in this male-dominated specialties like
Hmm.
surgery, um, orthopedic surgery, neurosurgery, radiology. It's so helpful and encouraging to young females to see other women in that field. So if you can find a mentor, find someone to shadow, that's going to
Hmm.
be really helpful to increase your confidence.
Hmm.
To those of you that maybe high school or STEM age or college age and kind of pursuing the sciences. Women definitely can pursue science careers as researchers, PhDs, medicine, just like men. There's like no limits to what we can do. So, don't let your gender, your race um, hinder you, from achieving your dreams and your goals. And so nowadays, I think medicine is a lot more agreeable to women and more conducive to women in
Hmm.
the field, which is good. There are still some specialties, as I mentioned, that are male dominated, but women are definitely making strides. You know, there's certain women that are the first orthopedic surgeon in their program or the first neurosurgeon in their program. So we still have a ways to go. There's still inequality with regards to pay and salaries with physicians
Hmm.
every field, not just in medicine.
Hmm.
Um, but we definitely have a lot to contribute for sure.
Wow. So that is super, super, super cool. Because STEM is just, is becoming so huge, and I really think women can make waves. So now, being a woman doctor in those male-dominated spaces, what has been some of your biggest challenges with being a woman doctor, one, and then two, being a black woman doctor? What has been some of your challenges? Those two questions: being a woman doctor, then being a black woman doctor.
Yeah, so one thing that my colleagues that are also Black females talk about is imposter syndrome, where you kind of feel like you don't belong there, or you feel
Mm,
like you're kind of out of place. It's like this subconscious thing that's in the back of your mind. And so it's like a constant struggle to overcome that and to not let that prevent you from um, being ambitious and goal driven in your profession. So it's definitely challenging, but for me, I get my strength and my confidence from the Lord. Like I know that I believe that God wanted me to become a physician. So being the only Black person in my job and in my team um, doesn't really bother me so much. Um, so that's what I would say. I think we have to drive our strength from something like a
mm,
higher power, like from
mhm,
God, because if He allowed you to get that degree, to get in
mhm.
school, and achieve that goal, then He has a purpose for you. So it doesn't really matter, what other people say, what other people think. So that's what I keep telling myself when I have those thoughts of imposter syndrome. But I think finding a mentor is really essential. If you have young children and you're listening and you're watching, I didn't grow up in the U.S., so my upbringing is different. But finding a mentor, if you can, is going to be really helpful for your child because they may come from a family that doesn't have anyone that's a scientist or a doctor,
Very true.
and so for them it may seem something that's so far fetched or impossible. But if they find a mentor, like another person that they connect with, that can help, take them under their wings, it can help increase their confidence a lot.
Oh man, so that's awesome. That's awesome. So now, but to piggyback on that, piggyback, and you're a plant-based doctor, right?
Mhm.
So to veggie back on that. So do you feel in some ways that you are a trailblazer? And if so, just tell us a little bit why. Because I know you also are an entrepreneur. And so
Mhm.
you can tell us a little bit about that. And I believe it's New Well Health. So kind of just tell us about that trailblazer.
Yeah, so people do say that the lifestyle medicine. So I'm also certified in lifestyle medicine. I forgot to mention that earlier.
Okay.
And
Mm-hmm.
I was in the first group that took that exam. So I was one of the first group of physicians in the U.S. To become certified in lifestyle medicine. And then I also
Mm-hmm.
have a certificate in plant-based nutrition, and soon going to be working on certification in obesity medicine. And so, what I saw in the landscape in the plant based world is that it was dominated by white males. A lot of the famous, plant based speakers and social media personalities that you see are Caucasian, and they're
Mm-hmm.
usually males. But I didn't see any black persons that were, uh, physicians that were kind of out there and out front. So I really made an effort to put myself out there with my Instagram page.
Mm-hmm.
So I've grown that. I have, thankfully, with God's favor, really, I have to give him all the credit. I have 38,000 followers on Instagram. My page is the Plant Based MD.
Mm-hmm.
I've been taking a little bit of break from social media just the past few months, just to kind of like reflect. But my Facebook page as well, and just posting free information, because I realized that okay, there's disparities in care. People of color have um, worse outcomes from a lot of different conditions: heart disease, diabetes, higher mortality from heart disease, diabetes, kidney disease. And so, after doing the research and reading about how helpful plant based diets are, and reading how about 80% of chronic diseases could potentially be prevented with lifestyle changes, so healthy diet, I said, okay, people of color need to see someone that looks like them, who is living this way, who's encouraging them to eat this way so that
Mm-hmm.
they can think that it's possible. Because oftentimes we think that, oh, that's white people food. Some people say, that's not my food, or that's not my culture, or I don't want to eat that. But what we don't realize is that people back in the motherland eat a lot of starches, a lot of vegetables. They do eat
Mm-hmm.
meat, but they do eat vegetables and starches, yams, potatoes, boiled
Mm-hmm.
bananas, beans, peanut butter, different things like that. So
Yeah.
yeah, so I definitely have tried to uh, make a space in
Mm-hmm.
the plant-based world. And so now that I have an audience, uh, I'm sort of, with COVID, I've decided to transition a little bit to incorporating a bit more spirituality in it. So like the whole
Okay.
person.
Mm-hmm.
So that's kind of what I've been felt impressed to do. As a 7 Day Adventist, and knowing that, hey, Jesus is coming soon. So at the end of the day, people are going to be people are going to be lost. So it's
Yeah.
one thing to have your health
Mm-hmm.
um, on point on this earth, but then to lose out on eternity, you know.
Yes. So you'd say, I don't want you to be just a healthy person, but be a healthy, saved person.
Right, right. That's it.
Wow. So, man, being a trailblazer and seeing that you're in the social media sphere, I mean, God's blessing you as you are blazing the trail and you're helping the masses. Like, again, I said, that's how I found you on social media. I said, I Googled just like, who are some plant based doctors? And you came up. So tell us a little bit about your new Well Health. You said a little bit about it, I think, when you were talking about your, yeah, just plug that. Say your website and everything again there.
Sure. So I started New World Health last year,
Mm-hmm.
with the goal of doing lifestyle medicine consultations. So working with patients who either have diabetes, high blood pressure, or obesity or overweight, and who want help with that. And so the office, actually, it was located in Raleigh, but since COVID, I closed the office space down and moved to virtual. But as of recently, what I'm actually moving to is doing more public speaking, webinars, and online events, because I can reach so much more people than just people that's in North Carolina. because
Mm-hmm.
most of the people that reach out to me don't live. About half the people live in North Carolina, but a lot of people reach out to me that live in other states. And so I wanted to find a way to reach out to them as well. So um, a few things in the works for that, working on a online course and online webinars. Like I mentioned last year, I had the summit, the Reclaim Your Health Summit, where I had
Mm-hmm.
21 Black healthcare professionals all talking about plant-based nutrition. There are people from different specialties, nutritionists, um, health coaches, fitness trainers, and mostly physicians, all Black doctors. And
Mm-hmm.
people said they had never seen that many, Black people in a summit. Kind of thinking about how I want to do it this year.
Mm-hmm.
That was in September.
Mm-hmm.
So COVID has presented challenges as far as in-person events and plans, but it has presented opportunities to do a lot of things virtually for people in different states. Like your church, you're in Ohio. I would have never been able to necessarily physically come, but it's been able me to do a lot of virtual events for um, companies and organizations around the country.
Wow, so a lot of opportunity has been created. Okay, um,
Mm.
so you talked about blending your faith with science. Um, Kind of want to ask this question now. Some people saying, "Oh, Dr. Judy, I've heard plant based, but we got to have some oxtails and rice." So,
Yeah.
oh, Dr. Judy, man, that chicken, man, the gospel bird is what's up. Is it really possible to become plant based? Some people say, "Oh, it's too expensive. The grapes are like $7 a pound." And this is kind of what we will end on, but and just encourage us when it comes to the plant based. Just share the positives again of why it is a good thing, so that people can leave away with some hope, that knowing that it's possible.
Yeah, for sure. I think the biggest thing is probably the mindset because it's different than what we're used to eating. So people sometimes think, "Oh my goodness, it's so hard." People always ask me, "How do I want to be plant-based, but I don't know how to do it. How do I do it?" And I didn't have like a rule book for how I transitioned, but I would say baby steps.
Mm-hmm.
Don't think of it as in though you have to be plant-based overnight in a week or in a month. Just do one small thing and say, let's say you're not used to eating vegetables.
Mm-hmm.
Okay,
Mm-hmm.
I'm gonna eat two vegetables with lunch and dinner. I'm gonna
Mm-hmm.
eat one fruit with breakfast. And
Mm-hmm.
that way you take it into bite-sized pieces and it doesn't seem as overwhelming. So I transitioned over like probably a couple years.
Uh-huh.
Like I was resistant to it really
Mm-hmm.
because it just seems so difficult. Because how am I supposed to cook and bake without eggs? How am I supposed to bake without milk? Like,
Mm-hmm.
what am I supposed to eat? Tofu and beans all the time? So I just gradually cut back on my animal products and I put them all in the same category when I was doing it: meat, cheese, eggs, milk, chicken, fish. I just gradually cut back and increase my vegetable and fruit consumption. And then over time, your taste buds will change. You it takes 21 days to develop a new habit. So you have to be persistent with it, right? Once you start to eat less of the processed food, less of the meat and dairy, you will start to actually love vegetables. Like now, I've been plant based for about 7 years now. I don't have the cravings for cheese anymore. I can look at macaroni and cheese, which used to be my favorite thing to eat, and just not have any desire to eat it. Even chicken. Like I don't even really enjoy the taste of chicken anymore. And it seems really weird, but I just love vegetables and fruits, and I never thought that I would be that way. Even ice cream. Like I love regular gelato. Like when
Mm-hmm.
I went to Italy a long time ago, I would eat gelato every day. I would never even think that I would be enjoying those plant-based ice creams. But over time, my taste buds have changed and adjusted. So now that I don't crave the sugary, salty, fatty foods anymore. So baby steps. That's kind of what I tell people. Reach out to me if you feel like you want some encouragement or support. I'll be happy to jump on a call with you. and show you kind of, how I've done it. I probably need to just type it all out, like how to transition to a plant-based diet, like make a guide,
Mhm.
because so many people ask me. And I think it
Yeah.
just seems overwhelming because they think of it as um, they have to do it overnight, but it
Yeah.
doesn't have to be overnight. And you can do it how you want. You don't have to take notes from anybody else. Some people say, I'm not eating soy products. I'm not going to eat processed foods. But if
Mhm.
that's not what you're feeling, then don't do it that way. I still eat the soy processed food sometimes, the soy
Mhm.
chicken things or
Mhm.
whatnot,
Mhm.
because sometimes I got tired of eating just tofu and beans. So you do it how you want to do it, but any way you can move the needle towards a mostly plant-based diet, and I think at least 50% of your food, if it's plants, vegetables, and fruits, you're gonna
Mhm.
be on a good start. So like making half of your plate produce is a good place to start. So for breakfast, I would have like two fruits, like an apple and an orange, and then
Mhm.
I would have like cereal. I eat whole grain cereals. Sometimes I would have like that Beyond Meat sausage. That vegan
Mhm.
sausage is so good.
Mhm.
I would have that with like an English muffin, or I make pancakes. I make vegan pancakes, but it takes time. It takes
Mhm.
time to learn how to cook vegan food, vegetarian food, flavorful, but it definitely is an adjustment in the way that you think about it. And so now I think about it as any dish that has chicken in it or cheese in it, I think I can create it and make a fully plant-based variety. And I
Mhm.
think it will taste good. And I've tested it out on a lot of my friends, and they are always amazed, and they're like, "Oh my goodness, I can't believe that this is plant-based."
Mhm.
So, yeah, and they can go on YouTube, look up videos, different people that have YouTube channels. I don't have a YouTube channel. I do have one, but it's not much videos on it. So I don't have cooking on there. Um, but yeah, just be creative, and don't be afraid to mess up. Sometimes you may try a dish and it may not come out good. That's okay. Just try it
Yeah.
again.
Mhm. Oh, awesome. I don't know if our audience here, they think we have time maybe for one or two questions. I
Yeah,
don't know if
let's
the
see what
audience would like
the
to
audience
just
is
post a
saying.
question. See what you're saying. If you'd like to post a question for Dr. Judy, if you're listening, want to post a question to her about women's health or anything she's spoken about, just drop a comment there if you're there, and then you can take those comments.
Hey, I meant to ask you if there were any comments on Facebook.
Comments, any questions coming through? Um, mhm. Yeah. Anyone else? Okay. Any questions? Any other questions from the ladies and ladies? All right. Okay. Well.
Oh,
Man. Yes, Doc. What you got?
oh, I see. I see your I just went to the page to see the chat.
Okay.
Yeah, I was gonna say if I could leave 2 points with the audience for taking home is preventative health is key.
Mm-hmm.
Um,
Mm-hmm.
40 and up, you should be getting an annual mammogram. Discuss it with your primary doctor. And colonoscopies, I recommend starting at age 45 for
Mm-hmm.
persons of color. So if you have not had your colonoscopy, please go get that scheduled.
Mm-hmm.
Um, you know, Chadwick Boseman passed from colon cancer last year, so people were becoming more aware of it. But um, getting that colonoscopy, that screening colonoscopy, is really important because it can actually look and see if you have polyps, or
Mm-hmm.
which can be precancerous polyps. So it's very important. And then with your diet, doing an assessment of where you are, being honest,
Yes. Yes.
and keeping a meal diary may be helpful because you may be surprised to see exactly what you're eating.
Mm-hmm.
And if you're not eating a lot of vegetables, you're not eating a lot of fruits, you're eating a lot of sugar, processed foods, um, you know, sometimes we think of God and spirituality as something that can help us with things outside the health realm. But God can help people to quit smoking. He can also help people to cut their addiction of sugar, because it really is food addictions that we're dealing with a lot of times.
Mm-hmm.
Addiction to
Mm-hmm.
sugars, addiction to salt, fat, and
Mm-hmm.
sugar.
Yeah.
Essentially what it is, right?
Mm-hmm.
So take that to God and pray to Him and ask Him to help you to overcome that. And I do believe that He will help you to overcome it, because
Mm-hmm.
all things are possible through Christ. So
Yes.
we have to take our health just as seriously as we have to take our physical health just as seriously as we take our spiritual health. We go to prayer
Mm-hmm.
meeting, we go to
Mm-hmm.
church, Sabbath school, and different things like that. But one way that we serve God is also by taking care of our body. One way that we worship God is by taking care of our bodies because He created us. And so He doesn't want to see us destroy His lovely creations. So it's really, really important. Um, and so hopefully that resonates with your audience and the people watching, um, to take care of the wonderful bodies that God gave us.
Well, I think that's a good place to end. You have encouraged us, you have challenged us, and we will take that to heart. So I want to say thank you for joining us today. Thank you again, Dr. Judy. Share with us where we can find you again, your social media handles.
Sure. Thank you so much for having me. I'm so glad that we connected. It's hard to believe that it's been 2 years now since that
Yeah.
event passed. We couldn't have it last year because of COVID, and we probably won't have it this year either. But my social media is the plant-based MD, plants like PLANT based MD,
Mm-hmm.
on Twitter, Instagram, and Facebook. Or you can also go to my website, which is theplantbasedmd.com. So you can reach me on all social media. You can send me an email. I would definitely love to connect and hear from you. And I am in Raleigh, North Carolina.
Yes. Well, you heard her information, everyone, and so we want you to check her out. Go to the website and all look, and especially look out for the conference that you did. And so we'll continue to follow you, like and follow her, share her information. It's life changing. And so again, thank you. Today we have had a courageous conversation with Dr. Judy Brangman. We would like for you to just continue to follow us. Again, we have another speaker next week. Her name is Dr. Jeremy London, and she'll be speaking with us. And then we'll close out the month with Pastor Amanda Holly. All of these women are making significant impact currently in society. And so we want to just thank them for taking the time to be with us. God bless you, and may God continue to bless you and keep you. Have a blessed rest of your day. Happy Sabbath. Remember today's blessing. God bless.